When I graduated from the College of Nursing, I worked in our hospital in Baltimore for several years. I was a medical surgical nurse. I became more and more aware that as a sister of Bon Secours, I had a role in that hospital. I was working hand in hand, side by side with other nurses and technicians and physicians, and that was my way of influencing the ministry. And then as I began to receive promotions, I could clearly see then that I had something to say about not only just my unit, but perhaps the nursing department. After several years, I was no longer up on the nursing units. I was really in administration, in the boardroom, working with physicians. As a vice president of mission in a Catholic healthcare facility, your primary role is really to assure that the mission and values of the organization are integrated within the operations. I was never a teacher, but I certainly learned to be one. It was teaching our story, teaching the values of Bon Secours, the story of the sisters and our charism, and relating that to the work in the organization. I oftentimes was the representative from Bon Secours to the diocese, to the parishes, to the civic community. At that time, I was also really the representative of the sisters in the organization. I have responsibility, general oversight for all the mission staff. When I first became a sister of Bon Secours and became a nurse, I never imagined myself in a role as a leader of an organization or an administration. The leaders in our organizations are really servant leaders, servants of the people that are giving, delivering the care, so that people that are doing the hands-on care can do it without a lot of interruptions, without a lot of issues and problems. And now in Bon Secours, and probably throughout all of healthcare, our focus and our attention is on healthy communities. That many times we need to be worried about housing and food and work before people can even want to think about their healthcare needs. And what are the needs in the community that aren't being met, just like our first sisters did? And what can we do to meet those needs? The ministry of the Sisters of Bon Secours is really a ministry of healing. You don't have to be in healthcare, because if you possess the skills and the values of healing, compassion, and liberation, you can do that in any kind of a role. Healthcare today is very holistic, and it's much more than just caring for the body. It's the body, the mind, and the spirit, and caring for the whole family. Very much like our early sisters, very much.